Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
It is our 10 at 10 feature on Thursdays here on Right Here, Right Now on AM 1480 KAUS, as you just heard, Restoring the Soul of Healthcare. And very glad to have with us this morning Lee Aase and Dr. Dave Strobel as per the norm for our feature today. Gentlemen, good morning.
Good morning. Glad to be with you, Jason.
Fantastic to have you with us here today, and I guess we're focusing here today that it's the final week for service savings at the HELPcare Clinic. Is that correct? Or?
Yeah, that's exactly right. I mean, ever since February when we opened HELPcare Clinic in Austin, we've been steadily increasing the amount of services that we have available. You know, we started out with a day or two a week with Dr. Strobel in early February, and as of right now, we're up to 5.5 days a week with the full services with a provider, either Dr. Strobel or Stephanie Kimmis, who's our nurse practitioner. And so, as we've been increasing the services, we've been steadily, raising the prices, raising the monthly subscription dues to more correspond with the level of service that we're able to offer. And those folks who joined early were doing it on faith and really believing in what this could be. And now as this is coming to be reality, we're just a week away from when we go into the full prices. So for people who are been thinking about this and are interested in joining now would be a really great time, because they can save $20 a month or more, over the long term on the membership. And what we wanted to do today was just really highlight the things that are included in the membership, just so that people have a good sense and review of what those things are. So, Dr. Strobel, maybe have you talk a bit about the diagnostic blood testing and the importance of that.
Right. Years and years and years ago, it used to be that diagnostic tests, lab tests, blood tests, things like that were of less importance, simply because they weren't very sophisticated. But now the diagnostic testing is so good in many cases that we can detect things by doing testing in people who don't have any symptoms of the thing that we diagnose. And so that allows us to detect it at an earlier stage. Now, that's not always the case for every disease, but it certainly is the case for many conditions, especially the ones that are very common in society. And so being able to determine that ahead of time and then take action preventively to prevent some of the complications of those conditions is really important. And so the ability to do kind of a robust variety of especially blood tests is just very, very powerful. And having the ability to do that kind of without any additional cost is one of the benefits of having a membership-based type of clinic, because our lab tests are included in the membership, and so things that might very well cost somebody $2,000 or $3,000 in another lab, we can do here inside the membership, because our cost is so much lower for these tests that we can include it, and it doesn't cost the person anything more at all. And so then you can learn things that you might not have learned otherwise. Very important information.
Yeah, so we had promised, that we'd have at least 45 of the most commonly needed diagnostic blood tests that would be included. And as Dr. Strobel and as Stephanie Kimmis, the nurse practitioner, have been seeing patients along the way, they've said, well, the patient needs this test too, or we should try that one because, based on their symptoms and, concerns, they were needing a different test. And so we're already up to more than 60 of these tests that we have provided as part of the membership at no additional cost. And as Dr. Strobel mentioned, that could be savings of, probably more than the cost of the membership for many patients just in the lab tests alone. The other thing we wanted to talk about is just last week we opened the medication dispensary, which is kind of an interesting concept as well. and would like Dr. Strobel to explain that too.
Sure. So we're not a pharmacy. There are different rules that exist for pharmacies, but for all intents and purposes, the patients would think that this is a pharmacy service. And what it allows us to do is to dispense a stock bottle of medication. So if you need 21 pills and we have stock bottles of 30, you're going to get 30, that kind of thing. So we're not permitted to open the bottle or put them back in another bottle and label them that way, but they come with an individualized label, and that allows us to be able to provide some medications. We don't have as broad a list as a regular pharmacy would, and the ones that we have are generic and inexpensive. So this is more of a convenience thing rather than a big cost savings. But it is definitely an additional benefit that some of our patients have really enjoyed using.
Yep. And then, of course, as we've said, the first two medications per member as needed, as prescribed, that are on this list will be included at no extra charge. But then we do expect that, currently we're at 28 of those medications. We expect that list on the formulary will increase over time. But the first two covered at no additional charge. And then if people need additional medications, we'd be working to get those at the lowest cost we can. And so for some people, they may have prescription coverage and prefer to go that way. And as Dr. Strobel mentioned, it may be more of a convenience issue. But this is something that we think will be a really helpful value for lots of people.
Yes, and we're hoping that for people that actually have to bear the entire cost of even the more expensive medicines, those won't be included in the membership, but we will be able to likely purchase those medications and then provide them at very minimal increase in cost to the patient. I mean, we need to store it, we need to document it, we need to make sure it's up to date and all that stuff. So there's some administrative costs with that, but it's going to be very, very minimal. And so probably even for folks that have to buy it outright, even the more expensive medicines, we may be able to provide for them at a cost that is less than they have experienced elsewhere.
Yep. And then, the next thing that we're offering that's included for all members who desire it is metabolic health coaching and opportunities to learn more about their body and how their metabolism works and the changes that they can make in their lifestyle that can help address some of the underlying causes of disease. And that's one of the things that Dr. Strobel is frequently referring, and Stephanie are frequently referring people in for coaching to be able to really actually address some of those underlying issues, so maybe they can even reduce some of their need for medications.
Yes, and that's actually one of the most potent things that the HELPcare Clinic offers is actually that service.
Yep. And then finally, just wanted to add, there are several things that we've now offered. We're now including all the things that had been promised to the founding members and others as they've been joining. But then we've added some other things along the way, like the FibroScan for ultrasound liver disease testing, in-body body composition testing. And then we're also doing Department of Transportation physical exams for the commercial drivers who need that. We're offering some of these latter things as an a la carte thing for people who aren't members. They could pay, the price for that. Otherwise, for our members, those things are included also at no extra charge. And so we just wanted to highlight that through next Wednesday, through August 31st, we still have the summer savings rate. It's the last week of it, $20 a month lower than the full dues. So instead of $149 a month for the singles, it's $129 a month. It's $229 a month for couples, $329 a month for families. And those same percentage discounts will apply for members as long as they stay a member, so that if the prices need to go up because of inflation in the future, they would still have locked in those discounts. So we really encourage people to stop by and see us at 308 4th Avenue Northwest in Austin. It's just between the Hormel Historic Home and St. Augustine's, right on 4th Avenue. they can give us a call at 279-2345, or they can visit us on the web at HELPcare.health. We're really eager to have people take advantage of this last week of savings. Next week it's going to be an affordable price as well, but it's a little bit better now. And so we just encourage people to, if they've been thinking about it, that now is a really great time to stop in and see us and sign up.
All right. And, gentlemen, just you were mentioning, Lee, about your website, healthcare.health, and I just wanted to jump in here quick that not only can people join right there on your website, become a part of it, and then just the cornucopia of other information. And, we've got learning modules, we've got blog posts, we've got discussions, and just a cornucopia of information. And, of course, like you were mentioning, the rates, but can our listeners sign up right there on your webpage? Plus, of course, garner all that other great information. Or
yeah, they absolutely can. If they go to HELPcare.health, it's HELPCARE.health. They'll see that there's an opportunity to join the online community, which is free, and so that's even way better than the summer savings rate. But they can get access to some of the videos that we've done with Dr. Strobel, where he's explaining a lot of these diseases and conditions and providing some practical education. But then also, finding community support from others who are looking to make some of the same kind of health changes and just learning more about the HELPcare Clinic difference. And so, going to healthcare.health or visiting us in person or calling that 279-2345 is a great way to learn more.
That's right. And again, I encourage the listeners to take advantage of those final summer savings to be a part of HELPcare Health. And again, that's unbelievably already next Wednesday, August 31st is when that is good until. So Lee Aase, Dr. Dave Strobel, thanks as always for being with us here on AIM 1480 KAUS for restoring the soul of healthcare. Gentlemen, have yourselves a great day.
And you're be blessed also.
Thanks, Jason.
Okay, take care.
Take care.